What most people don't know about healthcare in Sudan is that even people with money there can struggle to get the care that many Americans just take for granted. So I'm a doctor frustrated with the system, out to learn more about healthcare systems around the world and share what I learn. And again, this is about Sudan, not South Sudan, two separate countries. So let's talk to you about two different patients and then compare that to the United States. So in Sudan, even a wealthy patient may face real limits. They might go to a private clinic and they can pay out of pocket. But if they need something advanced like an MRI or a complex surgery, that care may not exist nearby, or that equipment might not be working. It might not even be available in the whole country. So what do? Well, if they can afford it, they often have to travel to another country, places like Egypt or Jordan, just to get imaging or surgery. Now, what if that patient was a poor patient, especially in a rural area? That person may go completely without care at all, with permanent damage or death as a possibility. Now, think about that for a moment. Because in the United States, even poor patients have access to emergency departments, advanced imaging like CT scans and MRIs, major hospitals with surgical specialists. Is it perfect? No. Is it expensive, frustrating, and unfair at times? Absolutely. But the infrastructure at least exists. And here's the part that's hard to sit with for me. A poor patient in the US may have better access to advanced medical care than a moderately wealthy patient in Sudan. And that's not because the US is morally better. It's because stable systems matter. This isn't about shaming anyone, and it's not about saying that the US system is good enough, but it is about realizing how much of the world lives without the basic medical access that many of us assume just as normal. Two things can be true at the same time. We can be deeply frustrated with our healthcare system and still recognize how fortunate we are to have access at all. So my question for you is, did this comparison surprise you? Has it ever made you rethink what access to healthcare really means? Comment below because I want to hear your thoughts. This is not something we talk about a lot.